If you're watching this video, it's maybe because you have tennis elbow, otherwise known as lateral epicondylitis, or know somebody that suffers from it. It's fairly common, and I would like to show you today some exercise and gentle mobilization I give my patient to work on at home in order to self-treat themselves. So the first thing involved with a lateral epicondylitis is generally some tension in the radial nerve. And the first exercise I would like to show you is how to mobilize your radial nerve. So in standing like this, the first thing you're going to do is on the involved side, which let's say my right elbow is involved, turning your arm in, lifting your pinky up, and bringing your arm out and a little bit back, and then immediately returning. You're going to stay within the range of motion where you feel the pull in your arm, not trying to go too much into the pain if it's painful at the end of the range, and basically just oscillating like this for 30 seconds. So you might have some variability from day to day in how far you can stretch, but a progression from just doing this is adding head movement. So you can do sliders and tensioners, which is what we call them. So with your head, tilting your head to the same side, like this. And again, just keep moving your arm, you don't really hold it there, like that. As well as tipping your head to the other side. And do this for, about 30 seconds. You can do it several times during the day, especially when you have elbow pain, as well as if you have other symptoms of tingling in your hand. Let me show you the next one. The second exercise is how to mobilize your radial head. So your radius starts here and work all the way down. It's your forearm. It's a little bit lower than where the pain will be than the lateral epicondyle. That's where most of your pain is going to be. If you go just like 2 finger breaths lower, you're going to be able to grab the head of that bone that's right here. Let's say this is the back and the front. What I'm going to have you do is grab the head like this and go from front to back, just like this, and just oscillate gently. Work on this for 20 seconds. Depending on the tenderness of the area, this might work more or less, or you might tolerate it more or less because of the tenderness. So this would be probably in a little bit later stage maybe. Just go back and forth like this. And you can do several sets. You can do this when you watch TV. The other one I want to show you is what we called external rotation of the ulna, which is the main forearm bone, like this. So for this one, and especially if you have pain with flexing and extending your elbow, which you tend to do with lateral epicondylitis, and actually with other elbow problem. So you're going to come at the base there and follow the line of your ulna with your fingers. You're going to go right on the edge, and what you're going to do, you're going to turn and twist your forearm a little bit more toward the outside, and then you're going to maintain that twist as you move your arm up and down like this. And very often that relieves quite a bit of pain, and that tends to be from pressure relieved from that area, just because sometimes the bone tends to get stuck. So just like this. So give that a try, and let me show you the last one. The last exercise I'd like to show you is an actual mobilization with movements. So you want to find a wall with an angle like this. I think that'll work better, or the end of a wall. You're going to place a towel right underneath your arm, underneath your humerus there, and that's going to allow you to put a little lean into the wall and put some weight. And what this is going to do is it's going to do half of the mobilization by moving your humerus this way, while with your other hand you're going to come here right below your elbow, and you're going to push outward the opposite way. And you're going to hold this at the same time, open and close your hand like this about 20 times. What should happen is that the pain diminishes as you go. You might have to do several sets in order for this to work, but as you go, the pain should diminishes. So don't forget that point. Just like this. And if that doesn't work, what I would do is just maybe try with a little bit of oscillation at first with your hand, just like that. So these were 4 different things you can do for when you have tennis elbow or lateral elbow pain. And that's the first thing I would try to do on your own, on top of icing the outside of your elbow. Other things that are going to help you is definitely the help of a manual physical therapist that can work on releasing all the tight tissue generally around your elbow, both on the inside and the outside, as well as along the pattern of your radial nerve, which is, as I demonstrated earlier, is a very important part of treating tennis elbow. They will also assess, a manual physical therapist will also assess your whole arm, as generally there's are some mechanical problem in the shoulder or the neck as well that are sometimes involved with tennis elbow. I hope this was helpful. Feel free to leave me any comments. Thanks.